Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to the folks from the Knoxville Center of the Deaf. For months, they have been a part of our media briefings and Board of Health meetings in order to make sure that important messages are reaching those that are deaf or hard of hearing. And we are so grateful for their partnership and want to extend our deep appreciation as they're on the screen right now talking about it. For a vaccine update, we have updated our vaccination dashboard on our website, which we will show you now. The data on this page will be updated weekly. This provides a countywide look at vaccination data. As of Tuesday, when this data was pulled, more than 34,000 vaccinations have been reported in Knox County. That's 7.3% of our population with at least one dose. You can see below those boxes that breakdown between one dose, or the breakdown between one dose and two. These include vaccines given by public health, hospitals, and pharmacies that are partnered with long-term care facilities. Here at Kchd, as of Tuesday, we have administered more than 6,600 first and second doses. Below those boxes, you can see a demographic breakdown of Knox County vaccination numbers by age, race, ethnicity, and sex. All of the data, with the exception of our internal vaccine numbers, are coming from the Tennessee Department of Health. We continue to vaccinate those in the first priority groups, including healthcare workers, first responders, and those 75 and older. For a full list of who qualifies, you can scroll down. I think you're looking at it right now. Our vaccine information page to see a list of all the phases as outlined by the state. For now, and for the foreseeable future, the demand for this vaccine continues to greatly outpace the supply. We have seen evidence of that during every vaccination opportunity that we have announced. As we mentioned on Tuesday, we continue to work with our county IT department to roll out a new online registration and scheduling system that will have a waitlist option. That said, it has been incredibly important for us to make sure that we found a system that can check all the boxes we need it to, especially when it comes to the automated scheduling of appointments. Our team has worked incredibly hard and has done a lot of research to find a system that is robust enough to handle the expected volume, while also having features that can be used internally by our clinical team to increase efficiency at the appointments. Because in the end, more efficiencies in our team is a great benefit to the public as well. We are still currently finalizing the contractual process to begin utilizing this system, which means we can't name that vendor yet, because we don't want to roll out this system before we can test it out and ensure it's functional. It will not be available until next week. That said, we have received more vaccines today and want to schedule appointments for those doses. So tomorrow, we will use our existing online platform to announce more vaccination opportunities for folks early next week. We expect there to be an additional couple thousand of first dose appointments available, and we will put up registration information, or we will put up the registration platform tomorrow afternoon. And as we did last week, we will send out a notification tomorrow morning with advance notification of the exact time that these appointments will be available tomorrow afternoon. So we're going to give everybody advance notice. Similar to last week, we expect these appointments to fill very quickly. For those without computer or internet access, you can call our public information line tomorrow at the designated time to sign up for appointments. 215-5555 is that number. And again, this is tomorrow, not today. We are setting aside specific appointments for those that have to call in. So hopefully it'll be a little bit smoother process than what we saw last week. Even so, we know there will be an incredibly high volume of calls coming in for those. So we ask for your understanding, as we will likely receive way more calls, many more calls than we have for appointments. Next week, we plan to launch the new automated registration system and scheduling platform with the waitlist system. When it's available, we will make an announcement so qualifying persons can put their names on the list for future vaccination appointments. We ask for your patience as we continue to want to make this vaccine available to as many people as we possibly can, as fast as we can. Now, moving into the local COVID-19 situation. We have 200 new confirmed cases since yesterday's report. 2,782 of those are active cases. 93 Knox County residents are currently hospitalized. And sadly, we have additional 11 deaths to report today, raising our total to 466. And now we will turn it over to the benchmarks. All of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving on to the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we saw new daily cases drop to approximately 179 per day, down from the previous reporting period, which is more than 200. We are optimistic about these numbers, but we are continuing to keep a close eye on them. Because of this, we are representing this benchmark as yellow. Even with this positive trend, we continue to stress the importance of the 5 core actions and ask that everyone continue to follow them all of the time. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, we have seen it decreased a bit in our community. That's also a trend we are seeing here at Kchd with our internal testing. We are no longer seeing the volume of tests or folks coming in to get tested that we were seeing before the holidays. On average at the health department, we are seeing less than 200 a day on the days in which we are testing. A few weeks ago, we were seeing more than 400 per day. This is consistent with what we are seeing across the community, across the state, and other areas as well. We are hopeful that this is an indication of a lower burden of disease across the community, but we will continue to keep a close eye on it. We continue to urge anyone who has symptoms or has been exposed to COVID-19 to please get tested. Regarding lab turnaround time, this number has continued to decrease and now sits in an average of 1.5 days for the community. Because of the lower testing numbers coupled with the positive news regarding a shorter lab turnaround time, we are representing this benchmark as a cautious yellow. Our third benchmark, sustained or increased public health capability. We are restructuring this benchmark to better reflect what our public health capability looks like. As the bulk of the response activities have shifted from case investigations and contact tracing to vaccine distribution, we are evaluating how we can best represent our capacity. Like our response has evolved, this benchmark needs to evolve as well. While we restructure this benchmark, we are not assigning a traffic light color for this week. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time, we have continued to see hospitalization numbers decrease. This is encouraging and something we hope to see continue. But we will continue to monitor these numbers closely. It is important to note that we are still sitting at a high volume of hospitalizations. It's just not as high as it was several weeks ago. After speaking with our hospital partners, they have recommended that the benchmark be represented as a stable yellow. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. During this time period, we have seen 65 deaths associated with COVID-19, which is consistent with what we reported out last week. The information available leads us to represent this benchmark as red. As we've said before, deaths tend to lag behind hospitalizations, which lag behind cases. We are hopeful that with the decrease in cases and hospitalizations that we will soon see the number of deaths decrease as well. But this will require everyone in the community, again, to continue practicing the 5 core actions to ensure that we don't experience another surge. Under the supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line shows 37 new cases per 100,000, and our 7-day trend line shows 32 new cases per 100,000, which is down from last week. The second chart shows the percent positive for COVID-19. The data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 15.64%, which is down from last week as well. For some context here, at the beginning of the month, the 7-day average was around 23%. So we are moving in the right direction. And with that, I will open it up for questions.
All right, please go ahead and submit your questions into the chat feature. And just as a reminder, because there might be a couple new faces in here, please go ahead and put your name and the media outlet that you're affiliated with when you type your question in. The first question we have is from David with WBLT asking when there's going to be another vaccine clinic and how has Kchd received a shipment this week. Both of those, Charity, I believe addressed in the talking points. I think you just had typed it in previously, but if you have any further questions, feel free to type another question in. And just so everyone knows, I see a couple questions about the YouTube channel. We did have to use the Kchd YouTube channel today as opposed to the Knox County one. So if anyone's having trouble finding the YouTube live right now, it is on the Knox County Health Department YouTube channel. Let's see. Allie with Knox News asks, is Kchd receiving the size and frequency of vaccine shipments that it expects? How much do number of doses and deliveries vary right now?
There is a little bit of variation. We're getting the vaccine that we're being told we're getting. The place we're trying to get is that's a consistent number from week to week. And so we are getting what we're being told. We're just being told usually that week or at the end of the week before exactly what that number is. So we're very much looking forward to a time when we can plan well out in advance for the amount of doses that we're getting to be able to schedule more efficiently.
From Scott with Compass, in anticipation of hospitals, pharmacies, and other providers being able to provide vaccines to the general public, are there plans to establish a clearinghouse for public information about events where and when people can get vaccinated? If so, when should it be available? And if not, why not?
Clearinghouse, can you specify?
Yeah.
At the clearinghouse, so like a joint information center type situation?
Where all public information can be available there.
Okay, Scott, I think that's a great question and a great idea. I think that as we get further into this process and we are able to expand into more partnerships, we will definitely want to look at how we can communicate our messages across the board, and we'll look into that. We have a extremely strong communications team here, and I think they will hopefully help guide us, but there'll have to be more information to come on that. We're just not at that point yet.
From Annie with WBIR, has January been the deadliest month for COVID-19 so far? Based on the benchmark charts from yesterday, we counted 135 deaths in December and 127 deaths in January.
Actually, yes, we looked at that this morning, and where we sit right now, including the 11 deaths that we reported out today, is that we are ahead in January of deaths for December. One of the 11 deaths that we reported out today actually did occur in December, but the other 10 were today. So that puts us, I believe, at 136 total deaths so far for December of what's been reported to us, and 137 deaths in January so far with 3 days left.
Annie, I believe that answered the second part of your question there as well. From Allie with Knox News, some people have reported severe side effects after being vaccinated if they've already had COVID-19. What should people know about getting the vaccine if they've had COVID-19, and is it safe?
Yeah, we would always suggest that you talk to your provider about your specific situation and circumstances. It is still safe, but you should expect to experience a robust immune response, and that means that the vaccine is working. So while it's uncomfortable, it's a good thing. But just know you can kind of keep up and talk with your doctor what that might look like. But you might feel some, have a fever and feel some fatigue and some aches and that kind of thing. Especially if your body is recognizing COVID and able to respond more robustly to it early on.
From Annie with WBIR, you've said in the past, Wednesday night is when Kchd finds out about vaccine allocation. Are there any updates to this week's allocation?
I think actually we typically get our allocation. We know for certain usually when they're coming on Wednesday, Tuesday, or Wednesday when we get the notification of shipments. But we typically hear from the state on I believe Friday, Saturday, Sunday over the weekend at some point. And so I don't know that we know next week's yet at this point, but we have received in today this week's shipment.
From Austin with WATE, will you all be restructuring the other benchmarks as well?
We're not really looking at those right now. I think that they all are still quite appropriate. It's just with the shift in the work that we're doing, we really want to more completely describe and talk about what public health capacity looks like right now.
From Allie with Knox News, how can people volunteer to help at vaccine clinics? Does KCHD anticipate needing volunteers as more vaccine comes in? And if so, who can help?
Yeah, we have a large amount of people who've already volunteered, and we welcome folks that want to. The best way right now is to volunteer through the Medical Reserve Corps, and we can get that out to our media partners later. There's a link to do that, and that essentially will put you in our pot of volunteers to be contacted to help with our process. It's a huge process. There's large pods, and we will be working with all of those folks as they come. So there's a lot of folks that have already signed up and been working with us, and we're very appreciative of that now, though, just so folks know about that.
From Jeff with WATE, a follow-up on a previous question.
Yeah.
He says a few people have told us they've had worse side effects from the second shot than from the first. Does the science back that up?
The most recent thing that I saw actually does, it kind of goes along with the sentiments or the thought process with people who've previously had disease having a more robust immune response. So with these vaccines, the first dose, I think Dina has described it here as being your primer. It's kind of getting you ready to go. And the second dose is really when the vaccine's able to do its job. And that's when you might see a more robust immune response again. So you might feel a little bit more, but again, that means that the vaccine's doing its job, and that's a good thing.
From Claire with WUOT, how many appointments are you setting aside for phone calls? If you don't have an exact number, can you give us a percentage?
We're going to try to set aside about 20% for phone calls versus the online scheduling system based on we've seen
taking so long.
You know, I think that we've been working through both the response and trying to get vaccine ready and trying to work through that as best we can. And then the systems that we were utilizing, we've realized that weren't as robust as that we hoped they would be. And as we work through the process, we learn from that and we grow. And that's what we're doing right now, is really trying to improve and make sure that the next system that we put into place has all of the things in it that we will need to be able to make this more efficient. But sometimes it really does just take learning as we go through the process.
And this is Catherine Killen. I just want to add to that. We've heard from some IT folks too that this has been a really incredible time in the IT world for software development, as many new softwares are being developed in an incredible pace to help health departments and agencies all over the country. And so our understanding is that the one that we're going to be using is relatively new as well. So it might not have even existed a few months ago, and others like it.
Another question from Claire in that same vein. She says the state is using Sign Up Genius, Shelby County is using VaxQ, and Davidson County is using RedCap for their vaccine wait lists, which are already live. Is Knox County planning on using one of these three platforms?
We'll announce the platform after we have the contract signed, and we will continue just to work on all of our processes to make sure that both the front end, the user aspect of the platform is as user-friendly as possible and very clear for the public, and that the back end is also as automated and as vital to our staff to be able to, again, improve efficiencies all the way through the clinic process.
From John with the Daily Beacon, other than the main KCHD building, what facilities are being used for vaccine distribution clinics?
We've been using the Merchants Expo Center primarily for our vaccine clinics, for the large ones especially.
From Jeff with WATE, we've seen some big swings in numbers over the last week. Some days brought 2 deaths, others had more than 10. New cases dropped by nearly 100 at the start of the week, then went back up nearly 100 today. I know we're supposed to look at trends rather than days, but is there some explanation for the data jumps?
We really don't have a good explanation. And again, I'm glad that you said that. That's why we really encourage everybody to look at trends instead of one day at a time, because then we can kind of see a leveled out picture of where we really sit. Some of it can just be delay in reporting for deaths as changes happen. Sometimes it's just we've had that many people unfortunately pass away on the same day. And so really encourage those trends to be looked at instead of the day-to-day counts.
From David with WBLT, what is the total number of vaccines for next week that will be open for sign up on Friday?
We said a couple of thousand.
And we'll have more information coming out tomorrow, similar to how we had last Friday, where we'll send out a news release tomorrow morning with more information just to give advance notice. And from Jeff with WATE, the Biden administration says more vaccine is coming. Have you seen the vaccine supply improve?
We're still, I think, working through the process that we've been in. And so we haven't seen that yet, but we're excited about that because, again, as vaccine supply improves, we'll be able to pull in more partners and get more access points throughout the community and get more vaccine out from week to week. And so we're really excited to see that happen.
All right, any further questions? Let's see, Jeff with WATE, can we get copies of emails that have been sent to Board of Health members? That will have to be through an open records request, Jeff. So if you want to submit an open records request through the Joint Information Center, we can work on that for you. Any further questions? Also from Jeff with WATE, bar owners are probably happy to get an extra hour for business, but what does that 1 hour mean when it comes to public health? How much or how little risk are we talking here?
You know, we've talked a lot about what the risk is associated with or behind the decision that was made by the Board of Health to limit those hours originally, and that risk is still there. And so when you're eating and drinking with people that aren't in your household in close proximity, and you're not wearing a mask because you can't eat and drink while wearing a mask, that's really a very high risk activity as defined by the White House task force that was in place, and several other CDC and other folks had mentioned that as well. So that doesn't change. And so what we hope is that people will still make wise decisions as they move forward to be able to incorporate and utilize the 5 core actions in all of what they're doing. And so we really hope that people take that serious as they move forward, even with this extra hour that the Board of Health has allowed.
From Vincent with Knox News, have you noticed a difference in terms of White House coronavirus task force reports on the data picture between the Biden and Trump administrations?
I have not, but I'll be honest, I haven't looked at the task force report that came out this week. I haven't been able to read it yet.
Any further questions? Please go ahead and submit them now. From Claire with WUOT, both the national rate and statewide rate show more than 6% of the population has received its first dose of the COVID vaccine. In Knox County, a little more than 3.5% of our population has gotten the first dose. Why is Knox County's vaccination rate lower than the national average?
Actually, we just reported out today that as of Tuesday, we were a little over 7% of Knox County residents that had received the total vaccine. So all of those would have had to get their first shot. And did I answer the question correctly?
Yeah, I think, Claire, just understanding, sometimes there's just differences in when data is updated onto different sites, so that could be the reason as well.
The other piece that can be sometimes confusing for folks is when you look at the state's website, the data on the first dose and the second dose are mutually exclusive. So the first dose, when people get their second dose, they move out of that first dose number. And so you have to add both of those to get the full picture. And a lot of folks are missing, didn't realize that. I didn't at first either. So just make sure you look at both of them and tally them up on the state's website. And then ours is a little bit different.
All right. The next question was from Vincent with Knox News, asking if we could send a copy of this week's report. If you could send an email to the Joint Information Center requesting that, we can get that over. It's also our understanding that these White House coronavirus task force reports will soon be public facing if they're not already.
I think they are already.
So
I think I saw that this morning.
Okay, so they are already public facing then, so you could look online for that report.
On the White House.
From the White House, not on our website. From Jeff with WATE, Will the YouTube channel change be the same next week or moving forward? And yes, Jeff, it's our understanding that we'll be utilizing the Knox County Health Department YouTube page moving forward. All right, any further questions, please go ahead and submit them now. All right, I'm not seeing any other questions come in, so thank you all for your time. We hope you have a good and safe weekend, and we'll talk to you again next week.